So quarantine fatigue is it's a real thing. And when I talk about quarantine fatigue, I'm not talking about the furious gun-toting protesters that are demanding states be haphazardly opened back up even when it's clear that states can't be opened back up. When I talk about quarantine fatigue like an adult, I'm talking to the other adults who have been doing what the public health officials are telling us we have to do, and who may be experiencing different types of quarantine fatigue. This can be psychological, this can be physical for people who are just around less and moving around less. And it can, of course, be economic, which we've been talking about as well. The people in the coronavirus is a hoax, this is government tyranny camp, they're living in another world. That's not who I'm trying to engage with here. But I do think that it's completely reasonable that by this point, if you're in one of the states that is 8 weeks into stay-at-home orders, even longer, or close to it in any case, there is significant fatigue that comes with self-isolation and the guidelines that we've been following. And I want to talk about a few different things. One is, of course, what we're doing is to flatten the curve, and we understand that. Nobody's questioning that piece, and that's why we're doing it. When we go out, we have to wear masks indoors and in places where you can't stay 6 feet away from people. You're not supposed to see friends and family that you don't live with. In many professions, you're either working from home, if you're lucky, or you could be laid off or even permanently fired. Your business may have closed for good. But people can only do it at 100% for so long. And the question is becoming, as people become more fatigued, what should be done? Clearly, flipping a switch and going back to the way things were would be a disaster. And we would undo a lot of the progress that we've actually made in the last 4, 6, 8, or even 9 weeks that this has been going on. But maintaining things exactly as they have been in the most closed states is starting to approach an expiration date. So what should be done? There's a really good piece in The Atlantic which explains if you just insist on keeping everything as is, keeping the strictest quarantine, it's sort of like abstinence only sex education, which we all know doesn't work. It's not realistic. It does not actually work. The more reasonable thing would be to be clear with people and have better, more detailed guidelines about what people can do. So let me talk about the all along stuff and then the moving forward. All along, it would have been better to get federal guidance on things that you should do. For example, go outside 15 minutes every day. A lot of people are not even stepping out of the door. Even if it's your front step or your building's roof or a backyard, depending whether you're urban, rural, whatever, just about everybody can step outside for 15 minutes. And every week we're learning more about the connection between vitamin D and coronavirus. We don't know that it's causal. We see a correlation right now, but it certainly won't help. It certainly won't hurt if everybody gets 15 minutes of sun every day. Total vitamin D would be up. Fewer people would be deficient. Mood improves with sunlight and outdoors, and risk is very low. If you can't step outside without being 6 feet away from people, then you got to wear a mask. Great. Would have been great to have clarity on that earlier. Most of the transmission is happening indoors between people living together. Then you have transmission at indoor workplaces and health facilities. Then you have transmission at indoor essential businesses, right? Like grocery stores, et cetera. Very far down is transmission from people outdoors. Of course, if people irresponsibly crowd together on a narrow hiking trail, it's bad. But the transmission happening outside from people passing each other on bikes, this type of stuff that's been spreading as if it's extremely dangerous, it's not zero, but it is extraordinarily low. And think of the good of people getting outside, getting sunshine, and hopefully doing some exercise, walking around, etc. Federal and state guidance on what are considered low risk versus high risk activities would be great. For example, and New York is now doing this, tennis versus basketball. I think I don't have to explain why there's a dramatic difference there. Also, harm reduction tactics for people who are determined that they are just going to do high risk activities. We are seeing that a lot of people just don't listen to the guidelines. In any other public health venue, we would provide harm reduction. If you are going to inject heroin, we at least want to make sure you have a clean needle so you're not spreading HIV. If you are going to be sexually active, we prefer you do it safely and give people access to contraceptives and sex education. If you are going to absolutely be doing an activity like this or that, Here are the things you absolutely must do to reduce the risk. Now, moving forward, there are governors that are managing the psychological component of this better than others. I'll give you an example. Is New York ready to open? Of course not. The numbers are dramatically improved, but the answer is they're not ready yet. So what is Andrew Cuomo doing, the governor there? He announced three advancements, so to speak, yesterday. Number one, so this is all starting Friday. Landscaping and gardening businesses will be allowed to open. These are businesses where workers don't even have to interact with customers. It's outdoors. This makes sense. And it is businesses that get to open, some people that get to go to work. That's a good thing. Outdoor, low risk recreational activities like tennis. Again, being able to play tennis outdoors, but not basketball. It makes sense. Everyone's really close together in basketball, not so in tennis. And Andrew Cuomo is going to open or allow to open drive-in movie theaters, which, of course, there aren't that many. I don't think there's any in New York City, but certainly a lot of New York State, most of New York State is relatively rural. And I don't know the number of drive-in theaters, but it's an activity and it is something that people can do. This is the type of thing that should be done now because it adds almost no risk, but it builds capital because people feel like something is going on. Now, it only works if people do the things they need to do when they are doing these different things. Charlie Baker here in Massachusetts yesterday announced that they're going to announce some first phase openings that could happen as soon as next week. I assume it will be very minor, low risk stuff. But again, the psychological benefit will be very big. Blue states are doing better at this than red states in total. Red states have been either doing the stay at home order where people are rebelling and it's imploding, or doing nothing and the virus is spreading like wildfire. There actually is a middle ground here. It involves very low risk activities, harm reduction, making people aware that there are things they could and even should be doing that are going to be good for their mental health and their physical health and get you more buy-in and allow people to behave safely for a longer period of time. Hopefully we'll see more governors do these types of things. Privacy.com is one of our sponsors, and they're giving you $5 just for using their free service at privacy.com/Pakman. Privacy is a service I've been using for a while now. I love it. It saves me a bunch of headaches. It's completely free, and it's very quick to set up. And here's how it works. When you pay for something online or over the phone, instead of exposing your real credit card number, Privacy lets you generate virtual card numbers. The payments are withdrawn from your checking account, but your real card number stays completely private, and you do it all with one click. You can autofill the card number in your web browser, on the phone. You can create 12 virtual cards a month. You can set spending limits, freeze them, delete them whenever you want. I especially love it for free trials where you need to give a credit card number because I can destroy the virtual card number as soon as I give it to the company, and I know I won't be charged in the future. If you're ordering food over the phone, why do I need to give a restaurant my real card number if I don't have to? Companies don't have to know who you are. Your real credit card number is protected from the data breaches that happen, unfortunately, more often than we would like, and it's completely free. They do have a paid version with different tiers where you can create more virtual credit card numbers per month, cashback rewards, extra security features. But go ahead and sign up for the free service. It's a no-brainer. Companies can't charge you unexpectedly. You're protected from identity theft. It costs you nothing. And Privacy is giving you $5 to spend just for signing up when you go to privacy.com/Pakman.